Okay, the last thing that I'm going to talk about is discussing normal newborn elimination, activity, color, reflexes, and vital signs. So when a baby comes out, it is definitely a big shock, both the mother and the baby, but the baby has to get used to living on the outside of the womb. So the baby at times will come out with a little bit of blueness to them. A little bit is blue. A little bit of blue is normal, the extremities perhaps, but extreme cyanosis is not normal. A baby should be pink, not overly blue, as I said. That indicates that there is some problem with the respiratory system. The baby should come out crying, moving around a little bit. This is normal. You don't want a baby to come out and they'd be limp, no cry, no response. We want to stimulate them until we get a response, some sort of startle or cry. It is normal for when the baby is first born to have a first period of reactivity, so that kind of happens from the first half hour to an hour, 2 hours. The baby is alert and awake, moving around. If you place the baby on the mother's chest, you may see the rooting instinct where the baby's going to kind of crawl up towards the mother's breast, and that is a reflexive behavior. So they're trying to get up to the breast to feed. That is followed then by a period of decreased responsiveness. So the baby becomes tired and they may sleep. This provides a good time for the mom and baby to snuggle, for the mom to look at the baby, partner, attachment. And then there comes a second period of reactivity. So then that lasts from about 2 to 8 hours. Sometimes the baby may pass the purse, meconium, or urinate, and then at this time they're already showing an increase in muscle coordination. So simply in the first couple of hours from being born to 8, 9, 10 hours later, you're seeing the baby become more coordinated in their movements. We will talk about the normal newborn elimination. We might as well do that now. So I mentioned the meconium. Meconium is a thick, tarry stool that the baby passes. Usually that passes the first day. That is from all the fluid and food that the baby had taken while inside of mom. This is normal for all babies to have this kind of bowel movement, and some babies void very frequently on the first day after birth as well. They have, again, all that fluid from the placenta, and they are unable to control their bladder, so they have many wet diapers that day. A little more about the newborn elimination. Now they're going to be eating a minimum of 8 to 12 times in 24 hours. So they are going to be voiding frequently. Their stomach can only hold so much, so they are going to be getting rid of that frequently. So the stomach empties in a short amount of time, and peristalsis is rapid. That's said to be about 2 to 3 hours. And those first stools, the meconium stools, are the result of the amniotic fluid that they swallow. Typically green to black and seedy. Once the newborn begins to eat outside of the womb, the formula-fed babies, their stool will look different from a breastfed infant. So formula-fed, it's more consistent kind of thicker, maybe formed, consistency of a peanut butter type of stool. Breastfed infants typically have looser stools, and it may appear that it's seedy. You might also see what looks like strings, and it's a lighter yellow, yellowish green. If your baby is not having much wet diapers, that is something you want to alert your doctor about. It could indicate a problem, or it could indicate that your baby is not getting enough food. Same thing if a baby is also not having bowel movements, that is something that we should alert the doctor about. Some babies experience regurgitation. If they have some stomach issues, which is common, my brother actually had this problem when he was born. He would just regurgitate everything that he ate. Sometimes that requires surgical intervention, and the doctor should be aware of what's going on. The baby should not be losing a significant amount of weight, and they should be hungry. Sometimes feeding the baby can happen right after birth. So the baby gets cleaned up and they're able to put the mom and the baby together, and the baby can nurse right away. Some of the reflexes, the instinctive reflexes. So there are quite a few. We talked about the crawling one, where the baby's on the chest and starts to crawl up to the breast. That is instinctive. The baby is looking for food, and it will automatically do that. The rooting reflex, when an infant is, when the mother or father or somebody strokes the infant's cheek, the infant is going to turn to the side that is stroked and search for the nipple. So they think it's a nipple, and they're going to feed. So they're automatically turning towards that side. The baby should also have an instinctive reflexive sucking when a nipple or a finger is placed in an infant's mouth. So it all goes back to the feeding. The Moro or startle reflex, this is one that if the baby is scared in a sense, they are going to lift and release their arms and legs and appear to be startled. So a nurse will typically assess that by carefully grabbing a hold of the baby's arms and slowly dropping them suddenly, and then they will outstretch their arms and legs when they are dropped. That is an automatic response. The asymmetric tonic neck reflex, also called the fencing position, when a baby is looking to one side, those extremities are going to be outstretched. So if our baby is looking to the right, both the right arm and the right leg are going to be outstretched, and the left arm and leg will be in. Same thing, they're looking left, the left extremities, the left arm, the left leg, they will be outstretched and flexed. And this is known, as I said, as the fencing position. The palmar and plantar grasp reflex. So when you put your finger into the baby's palm, they should instinctively grasp it with their fingers and close. Same thing with the foot. You put your finger in on the bottom of the foot, the toes are going to curl in as if they're trying to grab onto that object. The Babinski reflex is sort of opposite. So when you stroke the bottom of the foot, the lateral aspect of the plantar surface, the toes are going to hyperextend. They're going to go back and fan out like that. Another reflex is the stepping reflex. So you hold your baby out as if they're standing, kind of put their feet on the table or floor, and they're going to try to stand or take steps with you holding them. Now they're not going to be able to walk at that time, but they are going to instinctively try to take steps. Those are all innate responses in a newborn.